Our current version, which is Web Ambulatory 615, has made it much easier for us to communicate mostly with the ER physicians and with our current hospitalists and our cardiologists who are all sharing the same system. We're moving everyone onto one system, but those who are on it right now, the communication has been much better. And the reason I say that is this: I'm able to see and interact with their notes in real time. A great example is I saw a patient on Saturday, urgent care, who had been to the hospital 2 days prior, who had been put on a new antibiotic for a leg wound. And I had all that information in real time. So I was able to read the emergency room doctor's note, I was able to read the wound care physician's consult, and not having to switch systems or go hunting for data. In primary care, which is what I do, data gathering is one of my biggest things that I do in the data interpretation. So having that has really improved communication. So if I do have a question, it's very easy for me to pick up the phone and ask or send a message to other physicians. There are actually two examples. The one that we talked about before, where the diabetic had been in with the wound, was one situation. When I saw him, he actually had another issue that I was going to prescribe a medicine for, but because he was on the infusion that he was from the hospital, I made a different choice. Patient was elderly, patient had diabetes. I had to make a different choice because of his renal functions, which I would have had eventually, but I would have had to go on and find it. Because the patient came in not knowing, not necessarily ascribing any of this, just came in with cough, cold symptoms, right? And so he didn't necessarily have that information in his mind, but I had it in my system. One of the biggest things that we do in medicine is not only do we data gather, we also have to disseminate data, and we have to make decisions based on it. Having everything in one place made a significant difference. We came from a very disparate system. All of our clinics were on different systems, our hospitals on a different system, and they didn't really communicate well, if at all. And so you were having to thumb through a lot of documents in multiple systems, perhaps, to find out the patient's story. And this way, with one record in one place, it made a significant improvement for us to find information. So in that aspect, it's a huge time saver.